Oh! What? Missing eyeballs, why necks and knives don't go together, and just one more reason not to keep creepy dolls around. In honor of the new film coming out today, we're breaking down and reacting to the most intense medical scenes and demonically induced injuries from The Conjuring. Let's dive right in. Oh! What? Hit in the neck and we see blood just spray across the wall. They did a good job of spraying. So what would cause this? You have your jugular vein, carotid artery. You actually have your internal jugular vein, and you actually have an external jugular vein. Sometimes EMS or nurses might actually put an IV in that vein that pops in your neck. Oh, I command you. Oh man, that hurts me. I wasn't expecting that. We'll see somebody that comes in with like 1 or 2 fracture dislocations, maybe of the fingers. These could be dislocations, but most likely they're fractures. But where are they being fractured from is a bigger question. They're all going backwards, and they're backwards at the joint versus in the middle of the phalanx. Ow! Gosh, stop it. Oh! God, that's not cool.
It's not cool.
We can put them back together pretty easily, actually, in the emergency department. We'll end up anesthetizing the fingers. We will numb up each finger. We will get some x-rays to see if they're broken, if they're just dislocated, or if they're fracture dislocated. And then we need to put them back into place no matter what.
No matter what!
Ooh, ah, ooh. Drops down and succumbs to the injuries immediately. What would cause that? Injuries to the brain, get shot in the lung. You still have the other lung unless both lungs are shot, but will take some time. If you get a direct shot to the heart's still beating, and you're still getting some blood supply getting out of the heart until things collapse.
What did you do?
A lot of blood to the left flank. What organ is in the left flank there that we need to worry about? The spleen. The spleen is over there on the side. Your kidney's sitting there on the back side as well, lower part of your lung. And then your intestines and the ureters kind of chilling along the left flank as well. What did you do? Oh. Oh. Takes a single GSW to the epigastric area, lower part of your chest on the left side. It could hit your heart with a single bullet. The muscle is still functioning, and so the blood's leaking out around the heart. Oh! I would actually say that is more likely of a scenario to happen where there's like a slow process. You gotta get deep to slice in somebody's neck. The biggest thing we worry about as ER doctors in that scenario is actually your airway. We wanna make sure that the airway didn't actually get sliced open in between the cartilage. Oh, 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 ow. That's not supposed to rotate that way. We hear all this crunching noises. I don't like it.
I don't like it. I don't like it.
Commonly, people will like show me their shoulders and the crunching and popping noises. And that's usually the shoulder joint having a little bit of impingement somewhere of a tendon or ligament. Please don't continue to show me that it is doing that because you're continuing to irritate that specific structure.
The demon a soul.
When we have somebody who comes in with like shoulder dislocations, there's many different techniques that we can use, but in that circumstance, you probably want to quickly just sedate somebody, get them out of their discomfort by having them sleeping just for a short period of time and having the body relax, putting their shoulders back in.
I'll get it.
Are you serious?
You serious?
It is a super common injury for a pedestrian versus car to happen. The biggest things you see are multiple limb fractures, internal bleeding, and then intracranial bleeding and skull fractures. Typically, if somebody does get hit by a car like this, in emergency medicine, we'll try to be narrowed in the sense of where do we need to get pictures, but a lot of times we'll just pan scan, meaning we'll get a CT scan, head, neck, face, chest, abdomen, pelvis, where all your major structures are. Oh my gosh. A lot of blood to the left side of the face with a big hole where his eye should be. You can have a lot of lacerations to your face that bleed a lot. And even if the laceration is small, the blood can be everywhere. When somebody loses an eye, it'll have this like hollow look to it. But if you puncture the globe, you're still gonna have the structure of your eye still there. You're just gonna have it collapse down where the fluid comes out. If we have somebody that injures their eyeball and we think that there's a puncture, we don't wanna touch it because you don't wanna like squeeze any of the gelatinous material out of the eye. Oh geez, oh geez. Puncture wounds are actually a common injury that comes to the emergency department. You see people who get knife wounds, some lacerations, but puncture wounds are kind of a pain in the butt trying to figure out how deep they might have went or not. So sometimes you can have a laceration on somebody's skin that's maybe 1 centimeter, 2 centimeters wide, but you're like, okay, did it just puncture through the skin or did it go all the way through?
This is the first murder in that town's 193-year history.
Puncture wounds, you're gonna get imaging of the underlying structures. You're gonna get tetanus shot if they need it to be updated. If it's not badly bleeding, you will just bandage it for now because there's a possibility that they need to have an open laparotomy for exploratory surgery or repair surgery by the surgeon. Ouch. So stab wounds again to the body with a blade that's probably 3 inches long will cause plenty of damage. You can't get an image of the exact wound itself, but you're looking for massive damage to underlying structures. Say you get hit in the spleen, you're looking for leaking of the blood. Same with the liver. Oh, what's happening? Oh. If supernatural horror films like this one creep you out or stress you out, you may want to check out my doctor-formulated occasional stress support supplement called Chillax to help keep you cool under pressure. It's your calm vibes in a capsule. Find it at lifehappens.com or on Amazon. Single gunshot wound with what appears to be a shotgun flank going from the right side, going in an angle to your heart. With this type of injury and that amount of blood on the entry wound, it's a big enough caliber that's going to destroy the lung and destroy the heart. If somebody were then to show up on scene to resuscitate these individuals and they are pulseless, they do not have any signs of life, they won't be transported to the hospital. But if they have some signs of life, they're going to continue to do CPR and try to save this individual, bandage up the wounds, give them crystalloid or fluid to fill their structures up. Stop it. This is awful.
That's awful.
Shot to the head, it's not going to be compatible with life. And we do see this every now and then where somebody is still alive, but their brains are everywhere. We have somebody who's intubated, so we're breathing for them. Do we put somebody on a trach vent for the rest of their life versus do we donate their organs? Do we wait time? So there are a lot of different options. The Conjuring. I've never seen this. If you have seen it and you love it, let me know in the comments. If you want me to do more other clips, I believe there are other movies out there related to this, so let me know. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And as always, please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.